News, Mike Pochowski, CEO of the Wisconsin Assisted Living Association, Dale Kelm, CEO of Birch Haven Senior Living, Alfred Johnson, Director of the Bureau of Assisted Living for the Department of Health Services, and Sara Muhlbauer, CEO of Lakeland Care. Thank you all for sharing some of your valuable time with us today. Before we get started, I want to make sure we thank Badger Bay Management for hosting today's virtual event in partnership with Wisconsin Health News. Thank you. And also thank you to our generous sponsors of the Wisconsin Health News panel series. These important and valuable discussions would truly not be possible without their support. So a huge thank you to AARP Wisconsin, Ascension Wisconsin, Advocate Aurora Health, Group Health Cooperative of South Central Wisconsin, Husch Blackwell, Marshfield Clinic Health System, Wisconsin Medical Society, and WPS Health. An extra thanks today to AARP Wisconsin, today's featured sponsor. We are very grateful for their support. And here to say a few words is State Director Sam Wilson.
Thanks, Tim, and good afternoon to everybody. I am Sam Wilson, State Director for AARP Wisconsin. And I first want to thank Wisconsin Health News for their continued excellence in covering the many topics that healthcare providers, consumers, lawmakers, and opinion leaders grapple with when it comes to this incredibly important industry for the state of Wisconsin. These are incredibly important conversations with impacts on millions of Wisconsinites, and we're pleased to play a small role in helping make that programming happen. While virtual events don't allow me the opportunity to survey the audience for any potential AARP members that might be present, I always like to take the opportunity to introduce or for some reintroduce our organization and to highlight areas which we focus on here with our efforts in Wisconsin. Of course, our advocacy work receives a lot of attention, and we're incredibly proud of this advocacy work that's been a bedrock of AARP for the last 63 years of our organization's existence. But I'm also incredibly proud of the work we do in villages, towns, and cities across Wisconsin through our livable communities work, our fraud prevention work, and our driver safety and tax aid programs, both of which are the largest volunteer-led programs of their kind in the country. In fact, this year alone, we'll be investing nearly $250,000 into local Wisconsin communities and nonprofit organizations for projects that include neighborhood safety and walkability, older adult entrepreneurship, and healthy living and physical fitness. As an organization with over 820,000 members, 50 years of age or older in the state, AARP is acutely aware of the important role that health and long-term care services play in the lives of our members and that of the broader 50-plus population. From preventive screenings to prescription drugs to hospitals and long-term care facilities, 50-plus Wisconsinites' health security is contingent upon a very complex network of players being ready, some at a moment's notice, to address any health issues that arise. This last year made clear how critical that network is as COVID ravaged our communities. As of yesterday, while roughly 35% of cases were people ages 50 years or older, they accounted for nearly 97% of COVID deaths in Wisconsin. For many, complicated personal health stories contributed to their susceptibility to the virus, devastating families in spite of many taking what seemed to be adequate personal health and safety measures at the time. Hospitals and clinics were overrun by people needing acute medical attention, much of which at times was in very short supply. For many of our most frail and vulnerable elderly residents, the very places that we entrust for their personal health and safety failed to meet those expectations. Fortunately, the scientific miracle of vaccines has created a dawn of a new day, and many of those darkest moments of 2020 seem fleeting as if in a rearview mirror. But much like a car's mirror, the reality of what transpired is still closer than it appears. While we give thanks to the thousands of healthcare workers who work tirelessly to save lives, and we honor those who gave their own life to save others, we must not lose sight of this opportunity to learn our lessons from the pandemic. While we race to do things like hug our families and get back to the movies and enjoy fully stocked aisles of toilet paper, we need to re-examine the models for how we care for our most vulnerable and frail, how we rebuild our healthcare infrastructure, including our invaluable workforce, and how we ensure that this is the last pandemic that this or any nation has to face in the history of humankind. Again, on behalf of AARP, I thank Wisconsin Health News for the opportunity to be a part of this program. For more information on AARP's work, in Wisconsin, you can always visit us at aarp.org/WI or engage with us on our Facebook, Twitter, or YouTube social channels. Thanks, Tim.
Sam, thank you so much. We appreciate all the generous support. Thanks again to our panelists for participating today. Assisted living facilities are poised for future growth as the state population ages. The state currently has more than 4,200 facilities with capacity for more than 63,000 people. Over the next hour, we'll talk more about the interest in assisted living, how facilities are handling COVID-19, workforce shortages, regulation in the state, and the future of the industry. Alfred, I want to start with you. Thanks again for being here. As we come out of the COVID-19 pandemic, are assisted living facilities still seeing the same type of growth that they were a couple of years ago?
Yeah, and good afternoon, and thanks for having me. We are still seeing a lot of growth within the assisted living community here within our state, similar to what we're seeing across the country. Applications continue to come in. I think we typically average around several hundred applications that we're actively working on. So that growth continues at a steady rate. There was a slight dip during the height of the pandemic, but there were still people looking to open up settings to care for folks within their community. So we're still seeing the growth continue. People are choosing community-based care.
What type of challenges has this growth posed in terms of regulation?
Types of challenges. So, I think the stressing of the types of individuals that are choosing assisted living has created some unique challenges for our industry. The increased behavioral medical needs of individuals wanting to live in the community, and as settings open up, those challenges of finding sufficient enough caregivers, having operations or systems in place to manage the specific individual needs. That's something that's very unique about assisted living. Assisted living is built on the foundation of person-centered care. So if you're an 8-bed setting, a 4-bed setting, a 50-bed setting, that person-centered approach is key. So those challenges that the industry is facing of providing person-centered care to an increasing populations where their needs are more medical, more behavioral.
Thanks, Alfred. Dale, what do you think is driving this increased interest in assisted living?
Great, and thanks for having me as well, and also good afternoon. Certainly there's a thing we call the gray tsunami that's been coming for years. We've seen with the baby boomers aging, just the number of population in that age demographic, especially up here in Bayfield, Ashland counties, we're right at the peak of that. We're seeing a lot more human beings that just need care. And like Alfred had alluded to, we're seeing a lot more people who stayed, we're hanging on staying at home, which we're all for. If people can stay in their own homes, that's wonderful. But a lot more acute needs, a lot more behavioral needs, mental health needs. A lot of the referrals that we're getting are a lot of that population, that we're seeing a lot more of that than we have in the past.
Thanks, Dale. Mike, what do you think is Mike, anything to add? What do you think is driving this growth and interest in assisted living?
Sure. No, I would just echo exactly what both Alfred and Dale said. I think as the population continues to age, I think there's definitely a need for that. And also, I think people are looking to live in these types of settings as long as possible, settings that promote independence and dignity and allows them to do everything that they're used to doing, but also they might need some services. I think assisted living is able to provide those services to individuals.
Mike, how has COVID-19 overall impacted assisted living facilities, and how are they currently responding to the pandemic?
Sure, no, that's a great question, and I just want to also echo thank you for allowing me to be here, and thank you for this opportunity. I think COVID-19 has had and continues to have a huge significant impact on assisted living. First it was having a very difficult time trying to get personal protective equipment and trying to secure that and just having enough to be able to protect both staff and employees. I think just making sure that there's good infection control in all long-term care facilities. I think that it's still having some, lingering effects on communities in terms of, I think, we're seeing this right now. And I think Wisconsin Health News has done a great job of, indicating this in their news stories that occupancy continues to be down. And so definitely looking for ways to boost occupancy. I think there's still some lingering concerns that, will someone who move in potentially get COVID-19, or is it safe to live in an assisted living facility? It is definitely safe to live there and to reside there. And we just need to make sure that we kind of continue to boost confidence in both residents and families to move into these facilities.
Thanks, Mike. Sara, what's been the impact of COVID-19 on providers as well as MCOs?
Sure. Thanks, Tim, for having me as well. And I think taking a look at MCOs and I think our relationship with providers, early on, MCOs did come together and really tried to work uniformly as much as we could so that we were really coming at it with providers as one instead of each MCO having a different approach. And I think one of the other areas was really trying to work with providers on how to modify that delivery of services so that we could help support them where they were able to come out of this pandemic and still be there on the other side, because we needed to make sure that these providers were still going to be there because those services were still needed after this pandemic. So we had day service providers that people weren't feeling comfortable going to day services. They wanted to stay in their home. So how were we able to support day services during this time? So, modifying services by using technology. Residential service providers were now needing to actually provide services during the day where they weren't providing those services because they were going out and receiving day services. So then bringing staff into the home to be able to do that. As an MCO, we needed to be nimble. Our staff had to, go work remotely. Fortunately, that was something we were doing as an organization, but then stopping and not being able to go out and see our members, that was something that was really difficult for our staff, is to just be able to have those phone conversations or video conversations, doing an assessment and learning about an individual, not being able to truly put your eyes on them and in their home was something that was really difficult. And I think too, the financial piece for us was we felt like we needed to invest in some of our providers as well to help them make sure that they were going to be okay on that other side. And so giving additional funding for the COVID rate is what we had called it, giving some of our residential providers boosts through last year. And then also our day service providers, helping give them some additional funding just to kind of a stipend to get along. So those are some of the things that we did as an MCO through COVID, just to kind of get through and then help our providers see that other side as well.
Great, thank you, Sara. Alfred, can you talk a little bit more about the impact that COVID-19 has had on assisted living?
Yeah, thanks. And, one of the things I would really like the audience to hear is how well the assisted living industry, stakeholders, and a variety of different parties work together. This pandemic caught us all by surprise. And through this pandemic, the word that really sticks in my mind is collaboration for our collective industry. The department worked real closely with the provider community, with the trade associations, with local public health. We had state public health, we had the funders, UW, a variety of different individuals came together to rally behind what do we need to do. Mike mentioned about PPE, screenings, temperature checks, visitation, all these different things that needed to be comprehended. And as guidance was changing rapidly, we were able to work really collaboratively together on doing weekly webinars. We were able to put together what we call a rapid assist and support team, which was a combination of groups that worked 24 hours a day, practically providing responses to issues that providers were facing, that families were facing, that consumers were facing. So I think the industry really worked well during this time. There were some challenges, there were some stumbling blocks, and there were some hurdles. But the industry, Wisconsin, was able to overcome those issues that we experienced during this time. So COVID came, hopefully COVID is leaving on its way out, and we're better for it.
Great, thank you, Alfred. Mike, where do COVID-19 vaccination rates stand at your members' facilities? And what is your association doing to encourage vaccination?
Sure, no, that's a great question. Thank you, Tim. I think when you look at it from both a resident and staff standpoint, we're seeing high rates of vaccination among residents. They're definitely eager and wanting that vaccine, and they wanted it as quickly as possible. I say probably from a staff or an employee standpoint, it's a little bit lower. So I think what we're trying to do is just really kind of educate everyone on the safety of the vaccine and just why the need for it. And just, once we're able to kind of, have as many people vaccinated as much as possible, it's good for everybody. And so we've put on a couple of webinars hosted by a number of lead medical professionals within Wisconsin, just kind of promoting that, here's why the vaccine's important and here's how it is safe. And so we're definitely continuing to spread that message as much as possible.
Do you have Mike, do you have a ballpark figure? Have you guys done any polling in terms of what % of residents and patients amongst your members have gotten vaccinated?
I don't have that specifically. I can definitely pull that. It's kind of varies based upon the provider, but I can certainly get that information for you.
Sure. What do you see, Mike, sticking with you for a little bit, what do you see as the future of COVID-19 testing at facilities? Well, what is that going to look like going forward, do you think?
Sure. I think that each provider kind of wants to handle it in kind of their own way or their own situation based upon, whether or not are they seeing a high rate of positive cases coming in? Are they seeing a number of employees or residents who are exhibiting symptoms of COVID? How is it in terms of what, like Alfred mentioned, in terms of screening visitors? As visitors are coming in, what is that looking like? Are they seeing a number of visitors come in that exhibit COVID-19 symptoms? So I think each provider is kind of handling it a little bit differently. Some are doing the routine, consistent testing on an ongoing basis. Some are doing it based upon if they have, I guess, a quote unquote outbreak at their facility. And some are feeling as though we don't need to do testing right now because we don't have anyone who is currently tested positive for COVID. So it all depends on the specific provider.
Mm-hmm. And what about vaccinations? Have any of your members mandated or any considering mandating COVID-19 vaccination?
Sure. Another great question. And yes, we've had some members are mandating the vaccine. They feel as though it's important for them to ensure that all of their residents and all of their staff, based upon specific legal requirements, are fully vaccinated. Some feel as though that they don't feel it's important because they feel as though that, in their mind, in their own opinion, that residents and employees should have the choice of being vaccinated or not vaccinated. So it all depends on the provider. Some are doing it and some are mandating it and others are not.
Sure. Dale, what are you doing at your facilities? How are you moving forward on visitation policies, and are you planning to mandate COVID-19 vaccinations?
Sure. Again, great question. We are not mandating vaccines here. I would be on the latter part that Mike talked about, where I believe it is people's choice to receive that or not. Our infection rates have been extremely low, not necessarily in the community, but in our facilities. My Ashland facilities, we've had none. In my Minocqua, we had just a few. So I think the standard precautions and the precautions that we took, and that like Alfred mentioned, that collaboration, that was extremely helpful. We had about, I'd say 95 to 98% of our residents have received the vaccine. Again, they wanted it. It was something they were really looking forward to get. We're actually doing pretty good with about 50 to 60% of our staff have received the vaccinations. Again, up here, the counties were extremely aggressive with getting information out and getting that available. And those that haven't taken it, a number of them had personal medical concerns that precluded them from that. So there wasn't a big pushback against getting it. what we're doing currently is, again, those seminars that the state has put on. We've been just trying to follow along as best we can. During the height of the pandemic, honestly, it was fairly easy because we just shut down. As things loosened up, it got pretty tough, and I'm sure Alfred was in some of the conversations and emails that I and many owners received from families who, between them, ourselves, navigating all of the information that was coming out and who was really directing that information, got to be really tough over the last few months. Now we're getting to kind of a nice, screening people when they come in, and people are seeing their families. And I think the angst and the pressure that they felt to get in here and see those loved ones is kind of gone, because they're saying there is a way to do that. It's just a metered way.
And that's great to hear. Going forward, sorry, go ahead. I heard someone. Sorry, Dale. That's great to hear. Going forward, how are you moving forward on visitation policies?
Right now, again, it's always been, we want families and their loved ones to get together. We've always been in favor of that happening as safely as possible. And that's kind of the key, as safely as possible. Right now, generally, we just have people schedule when they're coming in so we can do that screening at the door. We still have some families that will just show up, grab mom and take her out. There's no punitive thing to that. Yeah, we discourage it, but again, they're their own people and their own families. So while we don't like when that happens, there's really nothing we can do about that except screen them when they get back and continue to watch for signs and symptoms like we've done. So right now, I'd say things are, visitation is good. It's like I said, a little metered and a little slower than it used to be. We don't want people just showing up willy-nilly, but honestly, it's almost back to, I'd say, half of normal, if that makes sense. Again, it's happening. We're just slowing the progress a little bit to facilitate it better for our staff and our residents to keep everybody safe.
Great. Alfred, has your bureau issued any kind of guidance on how COVID-19 vaccinations are shaping visitations, and overall, how have COVID-19 vaccinations impacted what guidance you're giving on how assisted living facilities should operate?
Yeah, so we have taken the guidance that the CDC has put out, and more recently, there was some guidance, I believe it was April 27th of this year, that expanded and helped us as we learn to live with COVID in our midst. So we are revising that current guidance. We plan to issue something out next week and hold an assisted living forum, one of those webinars, to talk a little bit more about that. But that guidance is really looking to expand. How do you have safe visitation, safe dining, safe activities within the setting, knowing that COVID is still within our midst? And the vaccine has obviously helped. It's been a true game changer by having more individuals within the settings vaccinated, the staff, families, all of us. That has really helped to stabilize things and encourage us to get back to what some people would call this new normal. And the new normal may include what Dale and Mike were talking about, those screenings and, scheduling things and trying to be as safe as possible for those that could be harmed if there's a transmission. So guidance is currently there on the department's website. There's new guidance that's coming out next week, and we plan to share that during an assisted living forum.
Sounds good. Sara, are there any actions that you as a payer of services plan to take to boost immunization at facilities?
Yeah, as an MCO, that is something right now that we're not looking at, especially since the vaccination is still just as like an emergency use. Really, we're, even as an organization, we're not mandating our employees to receive the vaccination. Currently as an organization, we're under 50% of our employees right now that have voluntarily given us that information. But I can share, last week DHS did share with us that as a family care program, the members, we are at about just over 70% of the members have received the vaccination at this point.
Great. Shifting gears a little bit, Mike, can you talk a little bit about how COVID-19 has exasperated workforce shortages. Well, what are some of the ways, and also what are some of the ways that the association is looking at addressing that?
Sure. No, thank you, Tim. And that's an excellent question. I think that, we've been talking about this for a number of years, and I'm sure that Dale can provide much more kind of specific information than I can. But right now, I would say the caregiver crisis and the workforce crisis is probably as worse as it's ever been. It was really bad before COVID. COVID made it worse, and now it's just as the worst it's ever been. And so our providers are scrambling, trying to find caregivers and honestly any kind of employee to work in their facilities right now. I think what we're trying to do as an association, and this is kind of very timely as the Joint Committee on Finances meeting today to kind of look at the budget in terms of Medicaid and healthcare providers, but we are asking for, and we have fingers crossed, very much hoping for a continuation and increased funding into the direct care workforce funding program as part of the 2021 through 2023 budget. And we appreciate all the support that we've gotten so far from Governor Evers. We've gotten from the members of the Joint Finance Committee, both the Assembly and Senate leadership, and all of the representatives, Assembly people, and all senators across the state. And so we are definitely hoping for that continuation and increased funding that would provide much needed wage increases and bonuses to caregivers that are working in facilities right now.
Great. Dale, I saw you nod your head at the beginning of Mike's comments. Could you talk a little bit more about how this pandemic has exacerbated workforce issues for you at your facilities, and what are some things you think could be done to address that?
Sure. And Mike is spot on. Before the pandemic, we were probably, as an industry, looking at about 25% of our workforce missing. Just 20 to 25% we just did not have. It's in 30 to 35% now. So we just don't have the people. We're getting applications, but attrition is tough. So right now, I could say, anecdotally for myself, I'm CEO of 3 assisted livings. I've worked every weekend since February. It's just my managers, my administrators, my assistant administrators are all working shifts. We're scrambling just to keep people on the floor. So it's really hellacious. It's probably the best word. Things we can do. We've tried creative staffing. We're much more flexible with things. If people, if they can work partial shifts, if we can, we need to have a safe number and a good number of people to care for the people that we've got. I mean, that's always what it is. Assisted livings don't run like a nursing home. Oftentimes we're running with 1 or 2 staff in a facility for smaller facilities. So one person doesn't show up, that's 100% of your workforce. So we're really trying to be creative with that, getting as many people trained as quickly as possible, which it takes 2 or 3 weeks to get a new employee trained to even get them on the floor, and then they're not necessarily experienced. So I'm working to really up the amount of training that we do, the times of training. I've done trainings on weekends and evenings, whatever will facilitate the folks that are taking the time to apply. On the negative end, our HR suffers a little bit. If we used to have a strict policy, but people didn't show up for 2 different shifts in a year, you no longer were employed. That's out the window. We bend a lot more than we ever have before, that I ever had before, but we just can't afford to lose folks. So if somebody is 6 hours late for a shift, we smile and we say, you need to be on time next time, and we just hope we can get it back again. So there's some good slippage or bad slippage there, and some good things. But that's really what we've been trying, is just we've offering incentives and bonuses. There has been state money that's been flowing to us over the last 4 to 5 years. We're using that to increase wages as best we can, to provide bonuses, sign-on bonuses, please come to work this weekend bonuses, whatever we can do to entice people to come up and work, which it's kind of pathetic, but that's the world we're living in.
Alfred, what can and what is DHS doing to help with this and address this?
Yeah. So really appreciate the comments from Dale and Mike regarding this. We know that caregivers are the lifeblood of this industry. Our governor back in 2019, I believe it was back in February, established a caregiving task force that some folks are on. and really looked at, analyzing, strengthening, supporting a variety of different ways to, keep the current people that are in the positions, but then also look to recruit, new people. How do you touch the heart of that caregiver? People are called to serve in this field. How do you touch the heart of those folks to come and serve and to care for folks? So our governor's task force, Mike talked about the budget items that would be crucial to see those make their way through to help our citizens who need the services. Additionally, DHS has looked at the waivers and variances of regulations. So when you look at training, orientation, some of those things, how can we speed those up or issue a variance of those so that you can quickly get someone in the facility to work? We've also developed some online training, or allowed online training instead of in-person training. That's helped to kind of speed that orientation process up. In addition, our University of Wisconsin Green Bay, we have an agreement with them to do some CBRF training registry for us. They put together a caregiver find a job network. So all of those folks that go through that training, they also were reaching out to assisted living providers saying, if you have a job, you can post it here. It's ripe, because there are tons of people going through this training who may be looking for employment. Here's a built-in network. And lastly, as I mentioned, on the DHS side, you often equate us with, regulators, funders, and all these different people, but we're just like, everyone else, and, trying to encourage more individuals to choose to answer this call to serve folks. So doing a lot of town halls, going to the high schools, connecting with those folks, for those folks that are under age 18 that could come into the workforce and consider this as a career field. So there's been a variety of things prior to the pandemic, during the pandemic, and now as we are coming away from that, to really encourage people to choose this as a career.
Sara, are there things that MCOs can do to help with this?
Yeah, I think, before I even get to that, Tim, I'd like to also add, I think another contributing factor to that is, as we talked about earlier, is that we're with the more complex individuals that are being served by the long-term care services, where these individuals are in the community. We're looking at having to staff these individuals a lot more heavy with, 2 to 1, 3 to 1. So that's requiring a lot more individuals in that caregiver role. So I think that also has such an impact on that caregiver shortage as well. And so then to go back to answering the question as to what MCOs, how we can support our caregivers through that. And I think some of the things that we have tried to do is with supportive home care is taking a look at members who are living in close proximity, and how can we have maybe one supportive home care organization that can maybe be that primary caregiver, so that there can be coordinated care for those individuals, so that we're not having maybe 3 different agencies that are, having to find providing that care all in the same area, so that you really utilize more efficiently our caregivers. And I think that's a good utilization of our resources. I think also taking a look at paying a premium rate when that need is there. So, we've had a couple of complex individuals that we've had to come through, and when we sit down with these folks, understanding that, when you're coming out of a Mendota or a Winnebago, that you're going to have to support these individuals really with a pretty high complexity, you know that on the front end, you want to be able to support these individuals successfully, so that you really need to have all of these additional supports on the front end, so that then over time you can start to back those services out, and then they can be more successful. Because if you bring them out thinking that you want to just do this really cheaply, you're going to continue to fall and fall and fall, and it's just going to be more costly, and it's going to really impact that member success and their, really their impact on life. And so it's really about understanding from that member's perspective and really having that support and that successful support for them. So I think that's really another avenue of addressing it. And I think self-directed supports is another way for managed care organizations to really help address this too, is what other neighbors, how can they help support those individuals that are living at home as well?
So Sara, on the funding side of this, what do you think of the use of pass-through funding, i.e. the direct care workforce fund, to address these issues? I mean, do you think that's good, or should this boost go to a capitation rate instead?
Absolutely. So the pass-through funding, to me, it's complicated because it has to, it gets calculated. There's just a lot of hands that have to touch that. And so it'd be much easier if it was just placed through our rates as they're established through a managed care organization, and our capitated rate. It would just be so much easier from our perspective if it could just be handled in that capacity. And I guess for the direct care workforce funding, the concern would be is, right now, as it's being handled through the legislator, that the legislative process that this funding is given. It may not always be available. And so that's my concern, is in 2 years, if it's not going to be available, then what happens? And our providers have really come to expect this and really have used this as a tool to keep their employees. And it's really important for our providers. And I don't want to see that go away. So that's where I feel like it really needs to be a part of that capitated rate, because that's how it gets into then the capitated rate going forward. Right now, it's completely separate and not a part of the capitated rate. And so will never be included in the capitated rate going forward for the program.
Mm-hmm. And Sara, so Lakeland Care recently changed its methodology for rates, which drew concerns from long-term care providers, especially because of costs associated with COVID-19. Can you talk just a little bit about why Lakeland pursued this change?
Sure. So in late last year, when we had our business plan, our annual business plan process, when we received our capitated rate, we knew that this was a significant year for us. Our difference was right around $10 million for 2021 that we really had to sit down and evaluate what we needed to do. And our big difference was our spend in residential. And so we knew that it was really time for us to sit down and evaluate how we were going to handle this. And so that's where we decided to really take the time to go through and make the changes, similar to how many of the other managed care organizations do their payment for residential services, which is through utilization of the long-term care functional screen to some extent. And so that is how we built our residential rate methodology, is based off of our functional screen that is completed for each member. And so we did not take and do a complete cut, I would say. It was really a reduction that was going to happen. I think we ended up only doing a partial reduction in 2021, knowing that providers did, have a rough year with COVID, and really trying to figure out what this was going to look like, wanting to make sure that our providers were going to be able to be okay and be able to handle it. We also had providers that had increases to their rate because members actually, their needs were higher than the current rate that they were receiving. But we really felt like it was time for our providers to be paid for the services that they were actually giving to our members on a member specific basis versus this is the rate that you're getting no matter what the needs are of the individual you are serving. So it was really about making it right with our providers.
So the Department of Health Services is seeking an increase in tens of millions of dollars to boost family care rates. If that goes through, would that undo these overall cuts? I mean, do you support these DHS-backed increase to family care rates?
Absolutely. It's not going to necessarily undo everything because it's not going to be the exact same amount of what we still needed to do, but very much support it because it's really about investing back into the program. And that's really important for us. You know, we're a nonprofit as well. So we can't continue to go in the red. Otherwise, we're not going to be here to be able to support the members. And that's truly our goal as an organization, is to be here for the members. And I feel like as a local managed care organization, that is truly what we're here to do. So our hope is that the department's work that we're doing is going to help reinvest that into the program and residential settings, that it will help to continue to offset the work that we did with our residential providers.
Great, thank you, Sara. Shifting gears a little bit, Mike, I want to direct this next one to you, but follow up on a point that Sara made about the rising acuity of patients in assisted living facilities. Mike, that coupled with this rising demand for services, how is that impacting, or how do you think that will impact staffing models for assisted living facilities as they will need to care for eventually more residents with potentially greater needs?
Sure. No, it's a great question. I think, Sara is definitely spot on with that too. I think that as people continue to age and the population continues to age and get older, their needs vary and their needs increase and whatnot. And so providers definitely need to adapt to ensure they're able to provide those care and services to those residents. And I think that, as a group, as we've kind of spoken about earlier on in this panel discussion, is that people want to stay in their homes as long as possible. And so with that, then, as they continue to age, they may need additional healthcare services or more complex needs or whatnot. And so I think providers are trying to do the best that they can to adapt to that, looking to the future to figure out, how can we adapt as an organization to make sure that we can provide those services to our residents. I think right now it's so tough. I think every provider is probably living right now, minute to minute, day to day, just trying to figure out what their staffing is going to be right now. And so they're trying to kind of figure out what it will look like in the future. But unfortunately, just the way it is right now, it's just kind of, how can I best provide the care and services to my residents at this exact minute?
Dale, could you follow up on that? I mean, you've talked about your situation. You're working weekends. You're struggling to find staff, like a lot of other facilities across the state. On top of that, as acuity increases for patients, I mean, how is that gonna start to change, if it will, staffing models for your facilities?
Like Mike had said, folks are staying home longer. And when we see them, it used to be, I'd say even 5-10 years ago, folks would move in and they'd age and progress with us. They might come in at the beginning of a need for services and we would progress with them. Now we're tending to get referrals, and Sara could allude to this too. We're getting referrals for people that are coming in with very acute and very specific needs right off the bat. Oftentimes they've just entered an MCO, so the MCO is even very unfamiliar with who they've got. We're getting these referrals, and unfortunately, even though we have some census that we could, we have open beds, we've turned a few people down just because we're not geared up to take it with our current staffing, with the current models, and with COVID coupled on top of that, which we, in my business, we never want to turn down a referral if we could handle it, but if we can't, we just can't. And unfortunately, those folks are ending up going to skilled nursing facilities where they maybe don't belong, but just for the acute needs that they have, their immediate needs are best met in a nursing home. And generally, people don't move backwards in the continuum, unfortunately.
Alfred, and this is a question from our audience that I'll direct to you, Alfred. Given the higher acuity of the current senior living resident, do you anticipate increased regulation of community-based residential facilities and residential care apartment complexes in Wisconsin?
Yeah. So the industry, as we've heard from the panelists, the industry, the people that are being served, are, the needs are increasing. They have increased. We're serving folks with some more needs. The industry needs to mature, and as the industry is maturing, that means the regulations are going to mature, are going to evolve, and those regulations are going to look very, clearly at the needs of those folks. So if it's something with training, increasing the training requirements, looking at folks with dementia in those areas, we currently have a statement of scope out there for the DHS 88. And that clearly defines what the department is looking to accomplish there. We are on the tail end of the adult daycare center rule, and establishing that rule. It was some standards there. So yeah, it's just it's natural for us to consider and for us to pursue this as the industry's maturing. Regulations need to evolve, and practices and systems all need to evolve. Also, the thing to consider is the incorporating technology. How do we safely incorporate the use of technology that promotes the rights, enhances the quality of care, may not take away staff, because you still need people to care for people, but how can that supplement the staffing issues that we're seeing?
So on the regulation piece, unlike most other healthcare sectors, states mostly oversee assisted living facilities with little of the federal regulation that we see in some other sectors. Alfred, do you think that's how it should be? Do you think we should stay as it is, or do you think the federal government should be playing a bigger role in oversight?
Yeah. State employee, state regulator, born and bred, and it's just falling all through me. The state of Wisconsin does a great job with this program. We have a really good system in place, a very collaborative process that's homegrown. And you can look a person in the face and understand, their needs, their issues, and work through. I think the state of Wisconsin does a great job in this area, and would love to see us continue to keep building the state of Wisconsin, keep building upon the existing structure. Now, there are pieces that we take from the federal government that, like the home and community-based settings rule back in 2014, we needed to incorporate that into our process. But let me tell you, when I talk about Wisconsin, Wisconsin's regulations were on par to those HCBS, or home and community-based settings rules. So we did not need to make substantial changes. So feds versus state, talking to a state guy over here. I like the state process, and I love our collaborative approach and our efforts to continue to work. If I can share one other thing, Tim, in our state, we have the only of its kind. There's no other duplicate of it. It's called WPS. It's the Wisconsin Coalition for Collaborative Excellence in Assisted Living. It's one of a kind. So you add the state regulations, you add this quality improvement piece. It's a match made in heaven for us to increase the quality of care and quality of life for those here in Wisconsin. There's no federal government involvement in those programs.
And can you, Alfred, can you just very briefly talk a little bit more about that coalition and what it does?
Yeah, so the WCCEAL, again, WCCEAL, but Wisconsin Coalition for Collaborative Excellence in Assisted Living, it basically allows the assisted living provider to not only collect information, but to involve themselves into trade associations' quality improvement program. So you're not necessarily just waiting for our staff to come in to tell you if you're doing, okay, if you're not doing okay. You're not waiting for a person to fall or a person to elope or something. You're developing systems in place. You're evaluating your systems on an ongoing basis. You're doing customer satisfaction, a lot of systems, what we would call root cause analysis, and getting to the state where that setting, if it says that they're providing dementia care, they're providing dementia care. They know their system. They're just not doing it for the sake of marketing. They're not doing it for the sake of, let me appease, a family member. They're doing it because it's the right thing to do. So the mixture of the WIXIL system that allows for data collection, for quality improvement, also access to some of the best standards of practice around. When you start looking at this increased acuity level, the providers have access to some good best practices or standards of practice. And it's a really good system. We really love to see that. I think we just passed, what is it, Mike, a 10-year anniversary with that. And we are just marching on. So more assisted living providers, whoever's listening to this, let's explore the WIXIL opportunity.
So Alfred, as you mentioned, this is pretty unique to Wisconsin. And I bet that you would agree that not every state does as good of a job as Wisconsin and overseeing assisted living facilities. On top of that, states have different definitions of what qualifies as assisted living. And wouldn't there be a benefit of more federal involvement to create a more uniform standard? I mean, wouldn't that be better? Wouldn't that be good for consumers who might be unsure of what assisted living entails?
Possibly, but there's also the regulators across the country, trade associations, providers across the country can learn from each other. There's a couple of national groups that are actually working on promoting best practices across the country. So if I'm in a neighboring state, say Minnesota, I can look at what Wisconsin's doing, and if Wisconsin is considered on the Mount Rushmore of assisted living programs, hey, is there something that we can look at as far as calling, a community-based residential facility or a line of services there? So consistency, when you look at terminology and regulations, would be great to have, but it's not the only way to do things. And Wisconsin and I think our neighboring states and other California and Texas have shown that they have been able to develop appropriate regulations and programs to meet the needs of their citizens, and not someone coming from the outside in mandating certain things. So there is some work being done with some national groups to help promote best practices and things. And I think we will get there.
Mike, what do you think? Do you think the federal government should be playing a bigger role in oversight?
So I completely agree with Alfred, and Alfred's mentioned a couple of times about the amount of collaboration between Department of Health Services and Bureau of Assisted Living and providers and trade associations. And I completely agree with him. And the collaboration amongst all of us is great, and definitely want that to continue. And I also agree with Alfred's points that I think there is no one size fits all for assisted living. And I think that's what you would have if the federal government were to come in and to regulate assisted living. I think each state does a great job in knowing who are the residents, who are the citizens, who are the providers, and being able to kind of, adapt and create and maintain regulations for those providers. I think, Tim, to kind of go back to your original question, and you kind of already, alluded to it, there's already some federal oversight on assisted living. And so, for example, and as Alfred mentioned too, you've got OSHA requirements, you have Department of Labor requirements, you have the HCBS requirements. So there is some federal oversight of assisted living, but completely agree with what Alfred said. The state does a great job of regulating assisted living, and it should definitely continue that way.
Great. So we are quickly running out of time, but I wanted each panelist to answer this last concluding question. We've talked about a lot. It's been a challenging 14, 15 past months with the pandemic, which has in many ways exacerbated several of the challenges facing the industry. As we get hopefully to a new normal, what do you think it's going to look like? Well, I mean, what do you see in the best you can to summarize this big question in a minute or two? What do you see as the future of assisted living in the state? And Mike, let's start with you.
Sure. No, that's a great question. I think we're all trying to figure out what that's going to look like. I think, as all of these great panelists have already kind of talked about, we're trying to look to the future and figure out what that will mean, as we continue and as we get past COVID-19. I think, the population continues to age and get older, and I think people want to stay in assisted living facilities or home-like settings as much as possible, and providers being able to provide the best care and services to them. I think that, definitely ensuring that we have a great staff and more staff to work in these facilities would definitely be very helpful and appreciated, and just kind of working through and helping to kind of improve the reimbursement program. I think that would be very helpful as well. So I think providers are just trying to figure out, let's kind of get through today and figure out, how that looks. But I think, as we kind of get through COVID-19, vaccinations increase, having great, sufficient access to PPE and everything else that's needed to kind of just make sure they're able to provide the best care and services to their residents and the residents that they serve in the future.
Thank you, Mike. Dale, what do you think? What's the future of assisted living in our state? Are we going to continue to see this growth? What do you think?
Sure, and I look at it in short, medium, and long term. Right now, short term, like Mike had said, we're triaging every day. We're trying to get through today. The joint finances meeting today, there's federal money, state money for medical assistance increase that has to happen. That has to flow to our direct care staff, the people working the floor, my administrators, my staff. We've got to start competing with other industries, and we just need to start putting our money where our mouth is. I think in the medium future, we're going to see a great increase. That great tsunami is coming. The number of people needing service is going to increase. We just know this. So we need to start looking as an industry, not only how we're going to meet those needs, but those increased needs, which is going to be specialized dementia care. I think automation is going to have to come in, as Alfred talked about, again, not taking away from the human piece. But I foresee hybrid versions of assisted living coming in the future, where they're not your traditional mom and pop assisted living, but they maybe have very specialized services. Again, unfortunately, it's going to need funding and people, and that's going to be the bugaboo in getting there.
Excellent. Thanks so much, Dale. Sara, what do you see as the future of assisted living in Wisconsin?
I think just opportunities to enhance collaboration on finding innovative ideas. That quick fix that Dale was talking about of really trying to find the staff. And what is it that we can do to support those facilities in doing that? And then I think really, how is it that we can really show that respect for the caregiving task? Because I think that's really an underlying cause, that there's really that lack of respect for that role, that it's really a key important role. And then I think the other aspect is how can we really catch that caregiver before they burn out? That I think is the other piece, is that, we kind of talked about that people are coming to assisted living when they're already, really acute. Well, that's because that caregiver has been caregiving and no longer can do it. So how can we maybe provide some of those services on the front end? So that's
excellent. Sara, thank you so much. Alfred, I will give you the final word.
All right, thank you. So the future of assisted living is bright because people matter. It's built on that foundation that people matter. And as people continue to matter, as we, encounter these hurdles, stumbling blocks, and different issues, it's based upon that people matter and that people will receive, they shall receive high quality care. Their rights will be protected. We have learned, and through this pandemic, we've had some lessons learned, we've had some lessons observed, and we're going to learn from those. We're going to be much stronger through that collaborative nature as we all mature. Regulatory, funding on the provider side, you name it, advocacy. As we mature, Wisconsin is going to be that place that the citizens that need those services receive what they need at the right time by the right people. So it's going to be exciting time. It's already exciting in Wisconsin now, but it's going to be much more exciting as we move ahead.
Great. Thank you, Alfred. Thank you all for really a great discussion today. Thanks to our generous sponsors for making this discussion possible. Thanks to all of you for tuning in today.